This stuff tastes nasty,
Okay.
but it doesn't hurt. It just tastes bad. Another one over here. Now this stuff tastes kind of bitter. It's going to decongest you. Okay. Just give you a couple of squirts. If it goes down your throat, it might taste kind of bad. Awesome. Okay, then I'm going to put a couple pledgets in, and these pledgets, they have a combination of both the numbing medicine and the decongestant both, okay? It's just like a little piece of paper that goes up inside your nose. And just going to sit right in the front of your nose just a little bit. Now we're going to let this sit for about 10 minutes. After we let it sit for about 10 minutes, we'll take it out. We're going to reapply that stuff and let it kind of decongest a little bit more. Any of that stuff going down the back of your throat?
Not too much, a little bit in the throat, not too
A
bad.
little bit, not too bad.
Yeah.
All right, just for a second. I'll take everything out of your nose, do all the injections. I'm going to take those little packs out inside of your nose. There we go. More numbing, topical numbing medicine. You might feel like your throat's feeling a little weird right now, like when you swallow it gets a little sticky or a little thick. That's normal.
Just feels like a little droplet going down the pipe.
Inside?
Yeah.
The question was that this looks to me like a fungal ball.
Oh, yeah.
The reason why is because there's that density. That density is almost as dense as bone.
Oh, my God.
That only happens typically with fungal mycetoma.
So is it a very small area that's really concentrated, or does it cover a lot of that space?
It's actually going to be this whole thing, and it'll cause a chronic inflammation throughout the whole sinus. So the first thing I'm going to do is I'm going to take the pledgets out that we put in just a minute ago. And we're going to take these out, and we'll get rid of these here. All right. Now, like I said, you're going to feel like a little stick and a sting when we look up your nose. So the very first area where we're going to take an injection at is a thing called the middle turbinate. You're going to feel a little poke right now. Good. You doing okay?
Oh, yeah.
Good. Okay, the second one is just a little bit closer to the top of the middle turbinate. And the last, we're going to do a little one in an area a little bit further back, closer to your sinus, called the uncinate. You doing all right?
Oh, yeah, it's fine.
Okay.
Just swallowing it.
Yeah, this stuff that you
Fluid,
taste,
yeah.
it tastes nasty.
It's not bad.
Might make your throat feel numb. There he goes. It's blanching. I'm going to put this right there just for a second. We'll come back to that in a minute. Okay, stick and a sting. There we go. Doing okay?
Just fine.
All right, so here's the one into the uncinate. Little stick. There it goes. Little stick. All right, that one blanched as well. Another little stick. Then the root of the turbinate. Okay. Good. Okay. So if I can steal the Entellus instrument, now this part goes pretty quick. What you're going to feel is, I got it, I'll get it. What you're going to feel is you're going to have a feeling like a little pressure and then like a pop. Now turn your head just a little towards me. Now we're going to follow the little instrument up there. Now this is the one that does all the work. And the instrument's going to go right up inside, just where we were before. And then what we're going to do is we're going to advance the catheter. And then I'm going to have Teresa, thank you. Okay, good. Now we're going to gently inflate it, and as we inflate it, you might hear a crack. You might feel a little pressure, but it's okay. And there you go. Good. Now it's all the way inflated. Good. Now did that hurt at all?
No.
Good. Okay. You hold it there just for a second. Now go ahead and deflate for me. And what I'm going to do is I'm just going to advance the instrument just a little bit more up into that frontal sinus. And okay, Teresa, can you slowly inflate it again? Great. That is exactly right. Okay, perfect. Go ahead and deflate it. Now we're going to take that out of there. You might feel like some drainage and such. That's going to come out of there. There we go. And We're going to move over to the other side and we'll be done with the front part, and then we'll be on to cleaning out that other stuff. Okay. Okay. I'm going to feel a little bit of pressure. Okay, Tracy, can you slowly inflate that? Okay, go ahead and deflate it. Did you feel that click?
Mm-hmm.
Yeah. Almost done with this part. Go ahead and inflate. Okay, good deal. Now, go ahead and deflate it. Okay. Okay, go ahead and inflate it for me one more time. Okay, and deflate. Now we're going to change the shape of the instrument, and we're going to go in the other device, in the other sinus that we had. Okay. Can you go ahead and inflate gently? Perfect. Feel a little pressure here just for a second.
Mm-hmm.
Okay. Now we're going to advance just a little bit more around the corner. Okay, go ahead and advance. Go ahead and inflate again. Okay, good. Can you deflate? Perfect. And then let's just take that fungus ball out. Now try to breathe in and out through your mouth as much as you can.
Okay.
Okay. You might feel a little pressure here again. Okay, go ahead and inflate it. And deflate it. Okay. All right, my friend. That's it. I'll put this in here just for a little while because you're going to get a little bit of bloody nose. And then let's go over your post-op teaching. Usually what we'd have you do is for a few days,
Yeah.
I'm going to have you use some saline.
Uh-huh.
And we label it 2 to 4 squirts. You do this 4 times a day.
Okay.
And then you're going to see me in about 7 days.
Okay. Well, you could feel the little balloon inflated, you know, it cracked a bone or two in there. Didn't bother me. Been waiting for 30 years to have it done. And had to find the right doctor, and then had to make sure with my situation that I wouldn't have a lot of anesthetic problem. Hopefully it'll help the patients downstream.
About 2 months since I had the sinus surgery. On the day of my procedure, the operation took about 2 hours, and I didn't eat much before the surgery. And so my daughter picked me up, and she said, "What do you want to do, Dad?" And I said, "Well, I'm pretty hungry." And so I just went and had hamburger and French fries and a root beer. On the day following my procedure, I went back to work. I should say that on the night after my procedure, I worked for several hours that night, slept good, and then next day just went back to work as I normally would. Had no problem at all. In terms of any precautions I took or may have taken after the procedure, I didn't do anything special at all. I just resumed my work. I felt very good right out of the chair, right out of the procedure, and I had a little bit of residual pain up in the nasal area for sure, but it didn't prevent me from just going about my regular activities almost immediately, so I didn't take any precautions. I didn't feel like I had to. I do play sports quite a bit. I play handball 3 times a week, usually 2 hours at a time, and those are very strenuous activities. And what I did notice, I was breathing much better toward the end of the games, and so my stamina was quite a bit better, and that was certainly something I didn't expect, maybe hopeful for it, but that was a wonderful outcome. In terms of my overall quality of life, I think it's really improved the state of affairs. It seems like my eyes had a kind of a watering. I didn't really feel like I had as good a vision as I should have. And now it seems like that watering of the eyes are down. And also I had an ear problem and had kind of what they call a swimmer's ear. And after the surgery, that ear problem has been rectified. I don't have it anymore. So I would just say better breathing in athletics. Eyes don't seem to water, and so my vision is a little bit better. And the ear problem that had existed for about 2 or 3 months has gone away.